Hi, everyone. I'm Michelle Burney here with Uncover Your Radiance Within, and I am a health and life coach. And some people may wonder, like, what does that mean? What does it mean to be a health coach? And because today's talk is a health topic, a wellness topic, I'll talk more about this health coach topic. And a health coach is really someone who is there for you to provide support, but to provide that accountability and wellness goals. And I think what I've noticed, and maybe what some of you can see too, is that our healthcare system is really about treating sickness. It really is about treating symptoms, about treating, something that's come to a point where it needs treatment, looking at more, what can we do for these symptoms, medications, prescriptions, procedures, that kind of thing. And I think what a lot of us are learning is that we really need to take control of our wellness. And a health coach can help with those preventative means. And like I said, that accountability piece, that support piece, in looking at ways to prevent illness, to prevent those visits to the doctor and, prescriptions and procedures and things like that. And today's topic is to ask for the blood work. And I see ads on TV all the time from pharmaceutical companies advertising all kinds of drugs for all kinds of diseases. And I don't think it's right. I don't think it's right that they're advertising, for people to go out and ask their doctors, "Can I try this drug? What do you think about this drug?" So if the pharmaceuticals can do that and really push and advertise for drugs, I'm going to push and advertise for this wellness tip, which is to ask for blood work. I'll share a situation that I encountered a few years ago, and what I mean by this. So it was just after my mom had passed of Alzheimer's back in 2021, and I scheduled a routine wellness visit in May. And, through the wellness visit, everything looked okay. My blood pressure is fine, that kind of thing. And my weight was good. I was feeling okay. But I said, "Can you run some blood work?" And the doctor, why? What are you feeling? It seems like your blood sugar levels will be fine, but like, can you just run some blood work? I want to see some numbers. I had been doing some research into Alzheimer's, and there are some things I've read about certain levels of vitamins and things. I'm like, can you just please just test my blood? Let's just look at where levels are. Well, I went and got blood work done at Quest. And literally the next day, the day after my blood work was complete, I got a call from my doctor's office. Kind of scary, right? I get this, voicemail, like, "Please call us back." And they're like, "You need to come in today because your vitamin B12 is so low that you need an injection of B12, like today." So I went after work, went to my doctor's office, got an injection of B12. I can't remember what the exact number was, but they said, "You need to come in weekly for injections of B12, and we'll do this for a few months, and then we'll go from there." And so I did. I came in weekly for injections for 4 months. And then after that, I went to monthly injections, and now I'm on just a vitamin pill. But that being said, when I did research, of course, I'm like, "Oh my gosh, what does this mean? What does it mean that my B12 is low?" And the doctor didn't give a great explanation of that. But B12, there's a direct correlation between low levels of B12 and dementia and Alzheimer's disease. A very distinct correlation between low levels of B12 and high incidences of dementia and Alzheimer's disease. And I, knowing my family's history, it was scary. It was very scary that who knows how long I was living with these low B12 levels, and who knows how long more I would have continued living with these low B12 levels if I hadn't advocated to just check into things. And I do have a functional doctor now, like I've mentioned, and a functional doctor looks more into root cause. And she is trained in some Alzheimer's protocol and things. So we do look at levels of things like B12, and we're trying to monitor and regulate, and besides my gut and things like that. But there are some certain things that I really encourage you, like, to ask your doctor, first of all, to go have those wellness appointments, but to ask your doctor to run a panel, to look at some levels of things. And I'll share some other things that I think you should maybe look into. B12, that was, for me and for anyone really, like, it affects your nerves. It affects your brain. So that was something important. I wasn't feeling any symptoms. They said I should have been, but I wasn't feeling any symptoms. So being that it was so low, I needed injections. Like, kind of scary thought that this could have continued on for a long time without, like I said, I didn't have any symptoms. Another one to look into is vitamin D. And I remember hearing through COVID that there were some initial reports that, high, vitamin D deficiency was being found in people with COVID or people with more symptomatic COVID or more severe cases of COVID. And I look now, and there are all kinds of studies into vitamin D and COVID. And there does seem to be a correlation between vitamin D deficiency and higher levels of COVID infection and some more severe outcomes of COVID. And I'm thinking to myself, back during COVID, when I questioned why aren't we pushing for more wellness, why not encourage people to take vitamin D? Why not encourage people to get out in the sun more to increase your levels of vitamin D? And that is something too that my doctor does monitor, because it is correlated also with Alzheimer's. A vitamin D level lower than 25, I'm not sure what that concentration means, but a vitamin D level of lower than 25 is a 25% higher risk of dementia. So there are these correlations out there with a lot of things. Vitamin D is really important for calcium levels in your body. It helps to boost your immune system, thus possibly the correlation with Alzheimer's disease. It reduces inflammation, blood pressure, and even they think there's some correlation with vitamin D and cancer. So why not want to optimize? And when I say optimize, so there are the normal levels, of course, 50 to 30 to 100 is considered normal. If you're on the lower side of normal, I kind of be concerned, because when you look at blood work, and it's really nice now, and I really recommend this too, is that Quest will have an app. It's called My Quest, and I actually do it on my computer. And my blood work now is sent to me even before the doctor has a chance to call me if there's any concerns or anything. So I'm able to monitor my different tests, all the different things I'm looking for, like my vitamin D. I can monitor that over time and kind of see where your levels are. And like I said, there's a normal range on there. So you're in the green, you're in the normal. But what they don't tell you is that normal is really average. And of all the people getting blood work done at Quest, this is the average. So to me, I don't want my health to be average, especially when you look at Americans and the state of our health and obesity levels and things like that. I don't really want to be in an average range, and I aim for more of an optimal range. And there is information out there on optimal levels. And in my research for Alzheimer's, 50 to 80 units. I think it's not milligrams per milliliter, but whatever concentration is optimal. And my functional doctor noticed I wasn't quite, I was in the lower end of that this last time, 61. And she encouraged me we need to bump that up a little more. And are you taking your vitamins and things like that? So I do take a vitamin D supplement. I take a B12 supplement. Other things that you can monitor in blood work is glucose. We talked about sugar last week. And it's probably good to know, where do your glucose levels lie? Under 99 is normal. If you're in the 90s, even higher 80s, like you're getting a little closer to prediabetes. And maybe that's a distinct sign that maybe I do need to watch my sugar. Maybe I need to watch those levels, or, consume less sugar, or be more conscientious. Maybe you need to cut out those sugary drinks. But just having that awareness could help, because you might not even know, you may not have symptoms, but you're getting on that higher level, inching up there towards prediabetes or diabetes. And that is something else that runs in my family. There's another marker that I had no idea of until a couple months ago, and it's called CRP. And it stands for C-reactive protein. It's made by the liver. It's an inflammatory marker. And chronic inflammation is really what they're learning is such a precursor to so many diseases, like arthritis, cancers, depression, diabetes, and Alzheimer's. So there we go again. And I didn't know this, but my doctor brought it up last time, because when I looked up what CRP was, it says it was related to cardiovascular disease, and it can be an indicator of heart disease. And that's something I never really worry about. Like, I never really am concerned about heart disease with my blood pressure and things like that. That's not one of my concerns. But this level was a little high. It was at 3.6. It's now down to 1. And the level should be at 0.9 or lower. That's average or optimal, is below 0.9. So my doctor was very happy that it got down to 1. But again, I think people should know, what is my inflammatory level like? Is inflammation out of control in my body? I don't even know it. Because there are things you can do to try to reduce inflammation. And like I said, there's such a correlation between inflammation and disease, is what we're learning more about. And it could be simple dietary changes, like cutting back on sugar and processed foods, and fats like fried foods, or it could be gluten that is inflammatory in your body. So there are certain things we can do to lower that inflammatory marker, thus making us healthier long term. Another one that has come up, and it came up in a conversation with a colleague, in terms of people who are active and athletic, is sodium. My sodium level was low, and I know we kind of brought up to think that sodium is bad. Sodium really, leads to high blood pressure and things like that. But my sodium level was actually low. And we think it's partly because I drink tons of water and I sweat every day. I go to the gym like 5 days a week. I get a good sweat in. And so my sodium level is really on the lower side. 135 is and 146 is normal. I'm at 138. And my functional doctor just said, you need to kind of watch that. You need to incorporate more sodium into your world. So I do put a little more salt in food. And one thing I do is even put salt in water in the morning with lemon, a little squirt of salt and water, little shake before I even go to the gym sometimes when I remember. So just being conscious of my sodium levels, because it does affect your muscles and it affects your nerve impulses. It can lead you to be lightheaded, almost like low blood pressure type symptoms if your sodium is too low. And I'd heard of a couple cases of athletes who thought it had to do with sugar, that they were low sugar or something. They were feeling lightheaded when they were playing sports. And it ended up being their sodium levels were low. And by drinking electrolyte drinks, by having foods and snacks like pickles, I told my doctor I started eating more olives when I have some more salt in my world. I like to just snack on olives for that salt. But like I said, we're kind of led to believe like salt is bad, so I stopped like kind of salting my food and things. But my sodium levels lean towards low, and like I said, there's some. I heard some stories about some athletes who thought there was something wrong with them and their sugar levels during games and competition, but it ended up being their sodium. They needed to up their sodium. So I really encourage you to take control of your health and your wellness. It really isn't something that we can count on our doctors to do for us. Like, this is something that we need to do for ourselves. They can try to help us when we've reached that point where we need treatment, but why not try to avoid that? So be proactive with your health. Like I said, schedule those well visits, but ask for that blood work. Like, really ask to look at where your certain levels are, and ask. Quest is what I use around here, and like I said, everything is online, and now I see the change over time. Is it staying the same? Is it going down? My B12 actually went down in the last in March when I had it again. So we actually changed my vitamin. We changed the number of milligrams I'm taking because we want to kind of keep it at a higher, more optimal level for brain health. So really, yeah, be proactive. Get the blood work done, look into your levels, and just have a better understanding of what may be going on inside of you, because there are things going on that you may not be symptomatic over, or may not feel or see outwardly. But I think I'd like to know, for my longevity and my disease prevention, what's going on inside. So I encourage you, like I said, be preventative, get those well visit checks, but ask for that blood work and go from there. This is Michelle Burney with Uncover Your Radiance Within.